Well, welcome everybody to the Prostate Cancer Foundation's launch of its Stargate project. And we know that prostate cancer can have such a significant impact on our community. In any one year, 17,000 Australian men are likely to be diagnosed with prostate cancer. We know that our survival rates are improving, 95% for 5 years. But nevertheless, 3,000 Australian men lose their lives to prostate cancer every year. Some obviously within the 5-year range, more outside of it. And what does that mean? It means that we have to continue to work to provide information so as people can seek early treatment, have the best options for treatment, and the best knowledge about their local area. That's why today's Stargate project, which the Prostate Cancer Foundation is leading, is so important. It's about providing information to people wherever they are in Australia, particularly in rural and regional Australia. Sometimes people will wait perhaps too long to seek a diagnosis. Sometimes they'll wait too long for treatment. And so this is about making sure that everyone, everywhere has the information they need to support them on their prostate cancer journey, their treatment, and their understanding of what they can do next. As part of that, we're privileged to be able to support prostate cancer treatment across Australia. Within the PBS, $300 million alone allocated through PBS Medicines to assist with the treatment of prostate cancer, to support Australian families and Australian men in their journey have better outcomes and better treatments. But equally, there's research, and we've allocated over $80 million of research funding in recent years, 60 million of that through the National Health and Medical Research Council. But whether it's directly to the Prostate Cancer Foundation, and this is your 25th anniversary, and I want to congratulate you and thank you for what you've done and to wish you all the best for the next 25 years. Whether it's through many different other avenues, the funding that we've provided is in order to assist our researchers find better cures and better treatments. In particular, we've been able to more than quadruple the number of prostate cancer nurses around Australia. That's a really important step forward. That's about giving people the support where they need it, when they need it, to give them somebody to turn to, somebody with whom they can talk, who can guide them, support them, and assist them. It's a mark of who we are as a country. And so to everybody at the Prostate Cancer Foundation, I want to thank you. I want to thank you as a son. My father had prostate cancer. He was one of those in the 95%. He was able to survive with it, to thrive with it. He was given the help to manage it and lived a long, full, rich life, and it wasn't prostate cancer that took him in the end. But you've done a great job. And so from our family to your family and to all your families, I want to say thank you. And I am delighted to officially launch the Prostate Cancer Foundation's Stargate project for prostate cancer information for every Australian, everywhere.
Thank you there to Federal Health Minister Greg Hunt. Welcome to all of our viewers. My name's Will McDonald. I work for Channel 9 News here in Adelaide. It's my great privilege to be your host for today's webinar. It is a cause that is very important to me as well, and we are joining you live right across Australia to bring you the launch of the Stargate project. I'm joining you by 3 panellists who are all experts in the issue of prostate cancer here in Australia. Of course, firstly, I'm honoured to be joined by the CEO of the Prostate Cancer Foundation of Australia and President-elect of the Union for International Cancer Control, Professor Jeff Dunn, AO. Jeff's work in cancer control spans 30 years. He's dedicated his career to developing strategies that underpin cancer survival and improve awareness of the disease. So important. He is recognised as a world cancer leader and one of the world's chief proponents of research covering all kinds of behavioural aspects of cancer. That includes research, prevention, early detection, supportive care, and of course, quality of life is really what it's all about. Big welcome, Professor Jeff Dunn. Yeah.
Terrific to be here. Thanks, Will. I'll get the mute button right next time.
That's it. We're all on mute to make sure we weren't interrupting each other, but now we're underway. We can almost click off mute now. Thanks so much for being here with us, Jeff. Tremendous. I'm also pleased to be joined by Associate Professor David Smith, one of Australia's leading prostate cancer epidemiologists and lead researcher on the Stargate project. David has published extensively on prostate cancer patterns and trends in Australia, in particular focusing on PSA testing in Australia. Now, over many years, he's led one of the world's largest studies on prostate cancer care and the outcomes, documenting long-term quality of life effects of prostate cancer treatment. That's that term again, quality of life. It is so important, and highlighting the urgent need for strengthening the support available to men and their families. Welcome, Associate Professor David Smith.
Thanks, Will. I'm really pleased to be joining with you in the panel today.
Yeah, it's going to be great indeed. I'm also joined by Mr. Greg McRoberts, the president of the PCFA's Prostate Cancer Support Group in the ACT. Now, Greg is a prostate cancer survivor himself and a leading community advocate for men and their families who are impacted by prostate cancer here in Australia, using his knowledge from a lifetime career in the health system administration to help people. A big welcome, Greg McRoberts.
Yeah, hi, Will. Thanks very much. It's so great to be here with you and the panel.
Yeah, no, thank you to all three of you. It is wonderful. Now, for those of you who may not know, my life and my family's lives have been impacted by prostate cancer. I was diagnosed with aggressive prostate cancer in July last year. I was 42 years old then. Now, I essentially asked my doctors to throw the kitchen sink at me when it comes to treatment. So far, it's doing pretty well. I've had 6 rounds of chemotherapy. I've had 20 doses of radiotherapy. I remain on the hormone therapy. But my diagnosis, I really hadn't been made aware. I didn't understand that my own father's diagnosis of prostate cancer only 6 months earlier really placed me at a fairly increased risk of the disease, even at my relatively young age of 42. So like many in my situation, I was essentially caught off guard. But I'm certain one of the big factors getting me through is the fact that I've stayed strong and positive, both mentally and physically. And I've been able to turn to the experts for help and guidance and advice. And with that, Professor Jeff Dunn, I want to turn to you first. How can the Stargate project help men like me and others who don't know enough about prostate cancer?
Well, look, thanks for the introduction, but can I just upfront say thank you to you. And we're so very pleased to have you with us, and for you, sharing your own personal story and being part of the work we're doing means a great deal to us. And I just want to acknowledge that up front and put it out there for all of the panelists there today. Can I also say how pleasing it is to be on a panel with David Smith and Greg McRoberts, both good friends and long-standing supporters of PCFA. It's terrific to be here. And on such an important day when we do, as you say, share the news about the launch of Stargate. Stargate itself is an informal acronym which stands for Prostate Cancer Regional Fact Sheets. And if you look hard enough, you'll see the letters in there. As I said, it is informal, but the name was important because we want people to remember what we're about. And our aim with Stargate is dead center to raise community awareness about the burden of this disease. We want to encourage vigilance and, as much as possible, eliminate avoidable death from prostate cancer. And to do this, we need awareness. Importantly, the Stargate data is accessible and it's free, for everyone can use it. It doesn't matter whether you're in Melbourne or whether you're in Moranbah, you have direct access to this data. And we want to make sure that it's out there. Please go online and check it out. You'll find information about your own region right there at your fingertips. We want men to do that, to arm themselves with this information and to arm themselves with a purpose, and that's to take action. Whether that means talking to your GP about your prostate health, having a test if that's indicated, talking about symptoms, making an appointment to see a specialist, whatever it is. You know, what we know is it's important to take action, and our desire is that Stargate will allow us to encourage more members of our community, both men and, you know, their families, to take action about this. There are 89 fact sheets in Stargate in total. These cover every area of Australia, exploring your local averages and how they compare to national averages. And I suppose I must reinforce, these are statistics, and each of us are individuals, but they do help us paint a pattern, to understand trends, and to learn about rates of diagnosis, mortality rates or death rates, and 5-year survival rates. Importantly with Stargate, even more importantly, if I might say, for the first time in any jurisdiction, in any country around the world, we've added local level data about stage of disease at diagnosis. Now, this is critical because it does help us to look at late stage and avoidable deaths and what might be happening in individual areas where disease is diagnosed at a later stage. Now, these are all important aspects. These all help us understand prostate cancer patterns and trends, and these will all help us improve outcomes as a PCFA, as a community, and certainly working with our health professionals and hospital and health services. As you know, prostate cancer is a major health issue in this country. Nationally, there's about 16,500 newly diagnosed men with prostate cancer each year. Sadly, about 3,100 men will die of this disease every year. We want that number to be zero. Importantly, we know that about 15% of men are diagnosed with stage 3 or 4 disease when the prospects for survival are perhaps less promising than earlier stages. And this is a terrific example of where Stargate can help us ensure that we detect this disease as early as possible through awareness and through action, through individual vigilance, and through communities coming on board with us and with the men in their communities to make a difference. Stargate is a lever for community action, for policy change, and it will empower us and those who are interested in a world that's free from prostate cancer. It helps inform our strategies, and we will be making sure that we share this with communities, with men, with health professionals, with governments, to do whatever we can to improve survival and to improve survivorship and that all-important quality of life that has already been mentioned in this webcast. Thank you, Will.
Professor Jeff Dunn, thank you so much for that, to run us through exactly what Stargate is all about. It is so important. A big congratulations to the Prostate Cancer Foundation on what is truly a groundbreaking project for Australian men, and importantly their families as well. We can't forget about them. Behind each of these men, there is a lot of people who support them. But let's take a look at the Stargate website and how it works now. You can see there that was the Stargate project website. It is quite amazing and quite simple to find out all the information that you do need. It is quite an important one indeed. I now want to turn to Associate Professor David Smith, the project's Chief investigator, if I could. I understand Stargate has been a year in the making. David, how did the project come about, and how easily or how difficult was it to compile and analyse all of this data from right across Australia?
Yeah, thanks, Will. We've sort of travelled a year into our Stargate journey, and it was about a year ago that Jeff, Anne, and our friends at PCFA came to us at Cancer Council to seek our thoughts about how we could best provide this local information and data to men and their families about prostate cancer. So we were aware that there were a lot of resources out there, but they weren't always easy to access or to interpret. And so we were delighted to engage with this project and to turn it into something that we have today. So our mission was to pull together these interpretable fact sheets from the data that was available, and there are some great sources already out there. And we sort of started with what some people may know already, with the Australian Cancer Atlas. So this maps cancer incidence and survival for many different cancers, but at very small areas, and it covers some really useful information. But we wanted to add a few layers to that and to provide information and data at the local basis upon which we can build up this full picture for these 89 areas. One of the best parts of the last year was working with this dedicated team, not just from Cancer Council, but from other areas as well. It was very much a team of its time. We did everything by Zoom, Zoom, Teams, and email. And I know that many of the team are working at Cancer Council today and are tuning into this. So hi team. I'm not going to mention everyone, but I do want to mention Karen Chiam, who really coordinated, pulled the strings, made the team work, got us together every week, as well as getting the data sets together. So Karen's on maternity leave at the moment, but really like to mention her role. I mentioned that we sourced the data from various agencies, from the Australian Bureau of Statistics for the demographic information. We had excellent help from the Australian Institute of Health and Welfare and Mark Short and his team, who collate the incidence, the mortality, the prevalence, and the stage data that Jeff's talked about. That's so unique and so useful for these types of fact sheets. There were a few tricky aspects along the way. The choice of geographical areas was important. And we settled on what are called statistical area 4. If you choose an area that's too big, you lose the important detail of regional issues. And if you choose an area that's too small, you lose statistical power to talk about those things. So we settled on these 89 SA4s. Some of them are very diverse. So if you look at a map of SA4s, it'll be dominated by those huge regions, the remote regions of Western Australia and Northern Territory. But the great thing about them is that we've got a map in each one to show the area that we're talking about, as well as all the statistics behind those as well. We also spoke early on with PCFA about exactly what we can put in these. We would have loved to put in information about risk factors for prostate cancer, but what we know about prostate cancer is that there are only a couple of risk factors that we can really be certain of: age, family history, and ethnicity and genetics. But we don't have data at the small area to cover all those issues. So essentially, we're providing the composite data on the areas that we could provide information on. We have put some information in there about some of the health issues that are really important for men who've been diagnosed to increase or improve and retain quality of life. Again, we talk about quality of life, and those cover issues such as smoking, diet, and BMI. So I'm probably preaching to the converted, but we think that these are really important issues to consider, both in terms of the physical health and the mental health of men after a diagnosis of prostate cancer.
All right, David Smith, you're right. You probably are preaching to the converted, but the converted are the ones who are going to spread the message even further, which is just so important when it comes to health and all those risk factors that you talk about once you are diagnosed. It is vitally important to get that information. I know personally very much so. So a year in the making. I want to go back to Jeff Dunn from the Prostate Cancer Foundation. Could you speak to us about the significance of the findings that are in the Stargate project website?
Look, thanks, Will, and thanks, David, for the brief on the development of the project. And let me concur it's been a massive undertaking from a very talented team. So to everyone out there who's been a part of it, thank you. And Will, you're right, a year in, we've got this wonderful product. As we spoke about earlier, Stargate is a lever for action. And really that's what we're trying to get across. So if you're a man out there and you've never really thought about your prostate health, never considered, what to do about prostate cancer, if you're a certain age or a family history, this information could save your life. Understand your risk factors, take some action, and if appropriate, go and talk to a general practitioner about your prostate health. If you're a GP out there, this information will help your patients better understand the steps they need to take to detect prostate cancer, to talk to you about prostate cancer, and hopefully to detect it early so that we can improve survival rates and improve quality of life. If you're a policymaker, and there are some of you out there, this information will provide you with a compass with regards to funding. What strategies do we know of that will help raise awareness? And let's get on with those to make a difference. Let's empower behavior change, and let's make sure that we improve outcomes. What are the policies and strategies and regulations we can put in to make a difference? And if you're out there, if you're the federal government, if you are our government, Stargate in the most clear of terms demonstrates the need for a revision of our current screening guidelines. We need the federal government to partner with us in revising these guidelines to take account of changes and developments in technology and PSA testing to ensure that we have an easy to understand, easily accessible set of screening guidelines for prostate cancer that every man has, that every man's aware of, where we can start to make sure that we detect this disease across the country as early as we can.
Absolutely, Jeff. Detection is so vital. I can speak from all this personally, that when you catch the disease greatly affects what your treatment is, your chances of survival, all those kinds of things. So I can't emphasize that enough, and to reiterate what you said there, testing and maybe re-looking at the testing guidelines. Okay, let's move to Greg McRoberts. In your view, how important is this project for the prostate cancer survival in Australia? You work in the local community, so how important is this going to be for your local community and the men that you work with?
Thanks, Will. Yeah, look, absolutely. I mean, making men aware of the risks and early detection options is absolutely critical. The data draws attention to areas where we can vastly improve outcomes for men, not just by increasing sort of individual vigilance, but by highlighting sort of systematic issues so that policymakers and health professionals can step in making change and provide support. Many of the men who join the support group are completely taken by surprise by their diagnosis. Few of them ever thought that they were at risk of prostate cancer, and when they learn the news, they may not know much about prostate cancer, which can leave the men and the partners and the families feeling completely stunned and unsure about what is in front of them. My hope is that in this project we'll put prostate cancer back on the national agenda for men's health and well-being, recognising sort of the heavy burden of disease and the lifelong side effects for men who are living with it.
Yeah, absolutely. That's the thing that we forget about sometimes, isn't it? It's the lifelong impacts of getting prostate cancer. It continues on for such a period of time, your entire life, essentially, in many cases. It's something you have to deal with and treat and get through. And getting support and being able to talk to others really makes such a difference. I know personally it has, and I know from other people I've spoken to. Honestly, when you start hearing about the treatments and the drugs that you are dealing with, well, it sounds anything but fun, really. It's what it boils down to. There's been nothing fun anyone's told me so far in my prostate cancer diagnosis, especially when it comes to the drugs and the treatments. But I've ploughed on as best I can. So it's been great to hear directly from others that have survived and even thrived with prostate cancer. So that is such an important such an important point that I want to make, that hearing from people and getting support, like you said, Greg, is such a tremendous thing, and this is one way to help people do that. I think we're going to take some questions from our viewers, if we can. Now, we've got a couple coming in now as well, which is quite good indeed. I've got a question for Jeff. What are the PCFA's long-term plans for Stargate? I guess, where does it go from here?
Sure. Well, look, thanks for that, and thank you out there for the question. So, you know, today's a big day for PCFA and for prostate cancer control in the country, and we've launched Stargate. You know, it is, as we said, a lever, a platform to manage change and bring about change. You know, longer term, you know, we're hoping to build more functionality for Stargate. So, for example, we might look at opportunities to fold in, you know, Medicare data or private health insurance data and other sorts of things, which will help us better understand what might be driving the differences, or what might be driving, you know, higher rates of diagnosis in others and lower survival rates in others. We will be continually looking to add and enhance the program. Importantly, though, you know, Stargate for us, it's about information, it's about generating action, and it is about working with governments and serving as an important part of our public health and advocacy tools. We're hoping to use this to work with policymakers. As Greg said a minute ago, you know, we need to alert men and raise awareness, but we also need to work with policymakers and funders to design ways to make sure that we apply the best of current technologies to the early detection of this disease, to the treatment of this disease, to deliver best outcomes, and to ensure the best possible survivorship experience, that quality of life matter that we've heard before. That's where Stargate's taking us. You know, that's where we're going to apply this program in the longer term. And you know, we're feeling very optimistic about the role this program, this data, this unique apparatus we now have. We're feeling very optimistic about how it might help us achieve those things. Thanks.
No, thank you so much, Jeff. Yeah, it is great to be able to see all those numbers, because we need to see the data, because it's such a multifaceted disease when it comes to testing, treatment, age, risk factors. So it's great to know the plan is there to keep this going for such a long way and make it work, to get policymakers to change the way they think about it too. We've got a question for David Smith, Associate Professor David Smith as well. Is it possible to get data on PCA testing rates in different regions to put them into the Stargate fact sheets?
The great question, Will. And the simple answer is yes. And we've actually got a team working on that. So Angkor, one of my PhD students, who's working with Peter Bardet and Susanna Cram and a couple of others, we've got the MBS, the Medicare data on PSA tests since 2001 up until 2018. It's something like 27 million records, and we are mapping it down to small areas. And this will be really useful to try and understand some of the differences in both the diagnosis, but potentially also the outcomes of care for prostate cancer. So I'd love to see the next iteration of Stargate be able to overlay something like that to help us understand a little more the application and the use of testing in the population.
All right, indeed. That would be great to see. Thanks very much, David Smith. I'll turn to Greg McRoberts. Canberra is one of the best performing regions. What would your advice be to men in the, I guess, unfortunately, worst performing regions?
Yeah, well, that's a good question. I believe personally that the issue here is obviously testing. It's about awareness. And in your situation, and as in my situation, you know, awareness of the fact that we have, you know, a father that's had a high-grade prostate cancer previously as well. So, you know, people being aware of that information, you know, being aware of the options, knowing where to go to get that initial help. And I think I'm a very keen advocate for men to get out there and actually take control of their own health. Like, you know, so if you go somewhere and somebody says to you, oh, you don't need that, you're too young for that, say, no, hang on a minute, I've got a family history, I want that test done. Can we get this checked out, please? I need to know what my baseline is. So it's about taking responsibility and for your own health in this area, and getting out there and getting those tests done, and then watching your results. Be aware of what you need to do if things change.
Yeah, absolutely. I concur on that testing idea of getting, especially now I understand the family history stuff. If you can get people to get that baseline done when there is a family history, I can't even explain how important that is from what I've now learned. We've got a couple of other questions coming in as well. I assume this one is going to be for David Smith. Does the incidence data include private patients?
Well, the incidence data includes private and public patients. So the data is sourced from each of the state-based cancer registries, and that is a near 100% collection of anyone who's diagnosed with prostate cancer.
Absolutely. All right. Thank you for clarifying that one as well. Now, another one that's popped in is, I'm not sure how the Stargate website deals with this piece of data, but was there consideration given to include state incidence, diagnosis, outcome medians, as well as national figures, given that the state-based, noting that public health systems are largely state-based?
Shall I have a swing at that one?
I think it might be for you, David. Yes.
So great question, and we're really interested in state-based outcomes. So the data that would clearly identify that isn't fully available at this moment. However, there's a really good initiative that's being undertaken under the auspices of the Movember group to put together a national prostate cancer outcomes register for Australia and New Zealand, and they are collecting patient-reported outcomes, so we'll know not just about incidence, mortality and survival, but we'll also know about issues such as the clinical issues, such as margin status after a radical prostatectomy, but we'll also know about impotence, incontinence, rectal problems from different treatment groups too. And that's really a fantastic way to improve outcomes, by having data that you can feed back through to the system to say, this is working well and this isn't working so well. So what can we do to shift everyone up in terms of the outcomes that we'd like to see?
Absolutely. Thanks very much, David Smith. We've got another one here, which might be more of a statement, but I think it can become a question quite. Both the Jeff and Greg might be able to touch on this one. Some GPs seem to be unclear or indifferent towards PSA testing. It's certainly something I've heard when talking to other men, especially younger men, when it comes to PSA testing. Unfortunately, some people have been told, no, you're too young for a PSA test, and that's turned out badly for them. So I guess, how do we move it forward to make sure that every GP, has the exact right screening method that should be used?
So, Will, I'm happy to have a go at that up front. And thank you for the question out there, and it's a very important one. And if I go back to some earlier comments, but a key driver for us in getting Stargate up and running was to make the case for a new revised set of PSA testing guidelines. We need an easy to understand, easily accessible, universally agreed set of guidelines. So, part of getting the general practitioners on board is making sure they're part of that discussion. And we've got guidelines which are evidence-based, which men understand, and which they can easily explain to their patients, which GPs can easily explain to their patients when they come in. So we're all on the same page. We need our general practitioners, our health systems, our specialists, our communities, our health services, and the men themselves out there and their families, all with a set of guidelines which are universally accepted, based on evidence, easy to understand, and easily accessible. And that's our goal, because, that's the sort of situation we need to make sure that we reduce the impact of this disease on our community as much as possible. So please, out there, for all of you, if you're a GP, if you're a family member, if you're a man, if you have the opportunity, this is again an opportunity to take action, start discussions, talk with those that might have some interest or influence, and let's see if we can move this along. Thanks,
yes,
Will.
Absolutely. Thanks, Jeff. Greg, I'll kind of put the same thing to you, if possible. Like I said, what do you do? if your GP does say you don't need one or you don't have family history, is that something you've come across, or is the advice to say, no, I really want a blood test, or you find a new GP?
Well, my personal experience with this was about 18 months ago when, after about, I guess, 17 years post my radical prostatectomy, I've been, a period of 9 years, I'd had a gradual increase in my PSA level. The GP that I was seeing at the time, I'd seen this increase, and I'd reached a point where I had been told previously by the oncologist that I would need to then seek some further advice. When I put that to the GP at the time that I was seeing, he said to me, no, look, you're worried about nothing. Those levels are nothing. And I said, well, no, actually, I think you need to go back and just, relook at this and try and understand it a bit more, because in fact, it's actually telling me that I do have something that perhaps I do need to keep a check on. So again, it came back to me, I guess, being upfront and going, well, no, you know what, I need to do something about this. So I went to another GP, spent 20 minutes actually explaining to him how it worked, and then got the referral. So it's about, men really need to understand. It comes back to what I said before, Will. We need to really take that personal responsibility. I mean, we have to understand the workloads of all these people in practitioners and clinicians, all these people that we're dealing with. For them to be across everything is very difficult. So we need to be informed as men, and their families need to be informed, and we take control of it. And then as a result of those results coming back, GPs are going to become more informed, because they're going to go, oh, I didn't really think that those levels mattered. Clearly they do. So yeah, we just really need to take that personal responsibility, I feel, Will.
Yeah, absolutely love that, Greg. That's so true. When it comes to healthcare generally, personal responsibility, number one, because, everyone is busy. All kinds of people are busy, and we have to look after ourselves first and foremost when it comes to your PSA number, that's for sure. So I've discovered that asking questions is really so important while dealing with prostate cancer. It is the best way to get the information, those questions. It stops the worries rattling around in your head, because it's pretty easy to go down the path of what ifs and Dr. Google. So don't do that. Go to the right people and ask the right questions indeed. Now, of course, if your family and friends, if they want some more information, or if you want some more information, if you're listening here, or you see the link, or you see Stargate, please get in touch with the PCFA after today's webinar. There is so much help out there, so much detail and data and support out there when you help for us. So get in touch with the PCFA. They have been wonderful indeed. Okay, Associate Professor David Smith, I want to get back to you. We've seen great progress in managing prostate cancer in the past 5 years. Based on the emerging evidence that we have, I keep getting told that the future is looking really good when it comes to treatment. So I'm really hoping that is the case. What are your hopes for the next 5 years?
So, yeah, well, I think thinking directly back about the aim of Stargate, I'd ideally like to see that some of both the past and the current inequities that we've seen across Australia, I'd love those need to be reduced. And so I think overall, we do relatively very well in Australia, but not all men are benefiting from the high level of care, the access to treatment and support along the survivorship pathway. So I'd really love to see, and I think Stargate's going to help that. I'd love to see that some of those inequities are reduced. And again, knowledge is power, and the knowledge that we've generated as part of this can help shift some of those geographic issues. Over the last 5 years, I think, and I'm going to speak back to some issues that Jeff's been talking about here, we have seen changes in the way in which the diagnosis and the delivery of care is happening in prostate cancer, which is really positive. And some of those have been driven from Australian researchers. So we should be very proud of what we're doing in Australia. I think those do need to be taken into account in the revision of the guidelines for the early detection and treatment of early stage prostate cancer. So I'd love to see that moving ahead in the next 5 years, so that all men have got access to these great new opportunities that we've got to defeat this disease.
All right, perfect. Thank you so much, Associate Professor David Smith. such tremendous to hear that things are moving along in such a great way when it comes to treating prostate cancer. Greg, I want to turn to you. What are your hopes? What are your goals over the next 5 years when it comes to treating, beating, and helping other men with prostate cancer?
I guess thanks, Will. One of the primary things that I'm hoping that we'll achieve is that we'll see more men and their partners accessing support. There's just such a massive need for people that are even at the early stages of diagnosis and at any stage of the journey to have that level of support, and that's support at all levels. I think we definitely need increased investment in clinical trials, such as the therapy study, testing the effectiveness of next generation treatments. These are so important to the guys that are at the sort of the tail end of current treatments that they're on, where they need that next level. I think advancement of research to address lifelong side effects such as erectile dysfunction and loss of continence, and there's been some good move forwards in those areas just recently as well, with some recent figures that have come from trials in Melbourne of, I believe, nerve replacement therapy for erectile dysfunction. Improved understanding of what the risk factors are. This is just so important because I think the problem is that I've mentioned this previously to Jeff and other people from the PCFA, is that it's for so long now it's been seen as being an older person's disease, and I think as you and I, as you can see now, and definitely I was sort of 4 years older than you when I was first diagnosed. We both fully understand the implications of not understanding the risk factors. So hopefully we can do more to and certainly through Stargate, this is definitely giving that information that we need. And I guess also that the most, one of the most important things is government funding. I mean, to the politicians out there that are listening to this webinar today, I mean, you really need to get behind funding for new medicines and treatments. I mean, I deal with people through the group all the time that are at the end of their journey with current treatments. The need to be able to have new drugs and things coming into the market that can help, improve the life of these people is just so important, Will. So those things are just, all those things are very important.
Yeah, absolutely, Greg McRoberts. Thank you so much. I certainly do hope that when it comes to new medicines and treatments, that bring them on, I say, get the government to show us the money, because there's a lot of us out there. We all have family, we all have friends. The research is just so vital to helping people like me and so many other people listening, just to continue on with hope and strength, and knowing that there's another treatment after that treatment. That's such a great thing. Greg McRoberts, thank you so much. I want to touch also on what you just said about highlighting the risk factors too. I got diagnosed, as I said, at the age of 42. Didn't quite understand the family risk factor, given my dad had prostate cancer. I was only diagnosed 6 months after he was diagnosed. But I used my situation to not scare older men, but certainly make them have a good hard think about it. Because if I'm 42 and I've got prostate cancer and they're 62 and have never had a PSA test, I really hope they listen to me and go to the doctor and get a PSA test, because it's so important to catch it as early as you possibly can. I can't emphasize that enough, and I'm sure everyone else would agree with me, given what I've learned over the last little while. Finally, I want to get to you, Professor Jeff Dunn, CEO of the Prostate Cancer Foundation of Australia. You're leading the charge in many ways. What are your hopes for the next 5 years?
Oh, look, thanks, Will. Can I just say again how fortunate we at PCFA, and indeed how fortunate the Australian community are to have ambassadors and spokespeople like yourself and Greg, people who have gone through this disease and are out there prepared to talk about it, make the point, but forcefully, with compassion, about the importance of awareness and about the importance of getting messages out there and taking some responsibility and understanding your risk factor. So, look, thank you for that. I agree with David. David spoke about the importance of, equality of outcome. Why is it that there's, these differentials in outcome? We need to we need to start to smooth those out to make sure that everyone in Australia benefits equally from advances in technology, and Stargate will help us do that. Yeah, Greg spoke about a range of things, which I do appreciate. One of them, was about support. And can I acknowledge right here and now, up front and in the proudest possible terms, the association that PCFA has with over 130 support groups around the country. Groups like the one that Greg runs or facilitates. We're day in, day out there at the coalface in terms of supporting men, providing information, making the case, advocating locally. And we can't envisage change without the support and ongoing encouragement of that extensive network of groups. So to our support group network out there and our broader network indeed, Stargate again is a lever for action. And we hope you can use it to that end over coming days, weeks, months and years if necessary. Well, in your introduction, you mentioned that this was PCFA's, Prostate Cancer Foundation of Australia's 25th anniversary, and it is. Thank you for remembering the birthday. We do appreciate it. That's 25 years of contributions. PCFA began at Lane Cove Rotary Club 25 years ago this month. And some of our listeners out there might remember a TV personality, much like yourself, Will, at the time, a man called Roger Clemson, who was diagnosed with prostate cancer. And Roger and the Lane Cove Rotary Club really were the genesis of what is Prostate Cancer Foundation of Australia today. And we acknowledge with great appreciation our debt of gratitude to Rotary, to Lane Cove and to Roger for establishing PCFA. And, we talk with the Rotarians and we talk about PCFA as Rotary's gift to the nation because we are now a national health group concerned with improving the health and welfare of our community. Our hopes for Stargate, we hope to inspire action. I mean, if I was to sum it up, it's to inspire action. We spoke about some things that need to happen. We've highlighted the data, and we know from Stargate, it shows that the actions that we take today, they can improve tomorrow. So to individuals out there, to systems, to policymakers, to whoever, take action today. Okay, we can save lives tomorrow, and we're sure of that. We simply cannot afford to wait another 5 or 10 years. I mean, every year, there's 3,500 men die of prostate cancer, 3,200. In another 10 years' time, that's another 30,000 men. We can take action today to bring those numbers down. Prostate cancer deaths are avoidable. We at PCFA are committed to creating a future where no man dies unnecessarily of prostate cancer. And Will, to you, to our panelists, to everyone on this webinar, and to the entire Australian community, please join with us in this endeavour. Check out Stargate, take some action, and together let's make a difference. Thanks, Will.
Professor Jeff Dunn, CEO of the PCFA, absolutely perfectly said. So important, all of those messages there. Also, a big thank you to Associate Professor David Smith and Greg McRoberts as well for being part of our panel today. I just want to touch on that idea, though, Jeff, before we start to wrap up. 30,000 men, as you just said, 30,000 men. We could avoid those deaths over the next 10 years. And remember, as I like to always say, those 30,000 men have families and friends. There's such a massive amount of difficulty and heartbreak that we can avoid if we take action. Like you say, it is preventable. All of these deaths are preventable. We are getting the processes in place. I'm happy, certainly not happy I've got cancer, but I'm happy to be able to play my role in changing the way things are done in just the smallest way, because I know it can make such a difference. So thank you to all of you, and thank you to everyone who's been listening. I want to also thank the webinar today. Has been made possible from our sponsors, Amgen and Tyre Power Australia. Thank you so much, and of course also the PCFA. They are absolutely wonderful. They have helped so many people along the way. It gives me and my family so much hope for the future, knowing that there is such a research organisation and support organisation out there with nurses in clinics helping people. It's wonderful. As I said, I am someone who is fighting prostate cancer, facing the tiger, so I understand it. And it is the work like the Stargate project that inspires me, as I said, to spread the awareness and to also keep fighting the disease as well, because other people are fighting for me, they're fighting for other men. So I just want to kind of spread the message as best I can that we're all, it's a term that we've used a lot during the pandemic, we're all in this together, but I've discovered that we are all in this together in the last little while when it comes to prostate cancer. As I said, to other men and their families out there in a similar situation, I do want to reiterate that idea that you are not alone. If you need help or support, it is available. So reach out. It does make a difference when you talk to the experts, when you talk to other people who have gone through it. Together, we can really beat prostate cancer. I am confident of that. I know all of you are confident of that as well. So visit www.stargate.org.au. Today, get involved with the work of the Prostate Cancer Foundation of Australia. Make sure you log on to that website. Thank you so much to everyone out there across Australia who has been watching Stargate webcast today. Thank you.